Hello, thanks for stopping by. I'm going to go ahead and get started on this presentation. This is a 2021 Medicare Advantage Clarity presentation. We're hoping to provide clear answers to your Medicare questions. So this is me, I'm Tom Basie. I've provided both my phone number and my email. Those are both two good ways to get in touch with me. I'm licensed, I'm in the state of Texas, but plans like this apply to all across states in the US. So what I'm going to do is I'm going to share with you what we're going to talk about today. This is the agenda. Want to understand Medicare choices, talk a little bit about eligibility and enrollment, understand the advantages of Medicare Advantage plans. I will spend several slides talking about drug coverage. It's a point of confusion for a lot of folks. Then I'm going to show you 4 2021 Medicare Advantage plans side by side and show you the differences, show how certain ways are similar, certain ways are different, help you think about which one might be to your satisfaction or one that works for you. I will talk about agent assistance, how agents like myself can be of assistance to you. We'll talk about some additional resources that can be made available to you. And I want to mention briefly about why United Healthcare, why you might consider them as your partner in your Medicare journey. So at a highest level, Medicare, this is a red, white, and blue card with a person's name, a unique number full of numbers and letters, and then 2 effectivity dates for Part A and for Part B. This card, it's basically health insurance provided from the federal government here in the United States. Part A helps with hospital stays. Part B is doctor's visits or out of hospital medical care. In 2020, the deductible was a little over $1,400 for Part A hospitalization, and it was almost $200 for Part B. Most people have already paid for Part A as they work in the U.S. It's taken another paycheck. Part B, typically they have to pay for that, and the premium for most people for Part B was less than $145 a month in 2020. So that's Medicare at a high level. Now, it doesn't have drug coverage, though. Okay, that's fine. We're going to talk about it. 2 options that someone can do. Option 1, you can get a Medicare supplement, which helps cover some of the deductibles, for example, and a drug plan. Or you can get an Advantage plan, which actually has drug coverage included in it, and actually has some additional benefits like dental and vision that neither one of these 2 have in place. This option costs significantly more per month, but it can potentially have very little out-of-pocket costs, maybe some copays for drugs. Or conversely, an Advantage plan can cost very little, sometimes $0 additional premium per month, but then you do have to pay more copays as care is received. So option 1 versus option 2, I recommend doing at least one of these because Medicare by itself, number 1, doesn't have drug coverage, and number 2, it doesn't have an out-of-pocket maximum. I'm going to spend most of my time talking about Advantage plans here today for this episode. Okay, eligibility. Well, you got to be 65 years old. There's exceptions to that. You can qualify for disability, other special situations. And then also it is for U.S. citizens or legal residents who've lived in the U.S. for at least 5 consecutive years. But for the most part, we're talking about mostly people who are over 65 and mostly U.S. citizens. Okay, now when can you enroll? Actually, there's an enrollment window around the month that you turn 65. So actually, 3 months prior and or 3 months after is your initial enrollment period. Anytime in that 7-month window, you can enroll. You can also enroll. You can enroll in Part A, Part B, or both. You can enroll in a Medicare Advantage plan or a drug plan. Now, although you're not required to enroll in Part D, think of D as in drug plan, there is a penalty of 1% of the average monthly premium for each month you delay enrollment. Translation, my recommendation is sign up for something, either an Advantage plan or drug plan, to avoid that penalty, even if you're not taking medications. Because if you wait X number of months until you need it and you sign up, there's going to be a penalty on it. So that's my recommendation. Okay. A couple other windows where you can make changes. You can add, drop, or switch Medicare in the annual enrollment period, which is October 15th to December 7th. Every year, even if you're already on an Advantage plan, you can add, drop, or switch Medicare coverage there. Then the first quarter of the year, Jan 1 to March 31st, you can make a one-time change as well. So those are 2 enrollment windows that happen every year. In addition to your initial enrollment window, you got 2 options there. In addition, there are special enrollment periods. If any one of these 4 things happen during the calendar year, well, then you've got an enrollment period at that time as well. If you retire and lose employer coverage, there's a special enrollment period for that. If you move out of the plan service area, Advantage plans are typically network-based, and potentially your zip code or your county or where you live affects where the network is. So if you move out of that, then you get a special enrollment period because then you can sign up for another plan in your new area. If you qualify for extra help is financial assistance from the federal government. So if you hit financial hard times and you qualify, then there's going to be a special enrollment period. You can enroll in Advantage plans. There's some Advantage plans that are even have richer benefits than normal ones for people who are in need of financial assistance. And then if you get diagnosed with certain qualifying chronic health conditions, maybe diabetes, maybe certain chronic heart disease, if you get diagnosed with one of those, you can get a special enrollment period for that as well. So my message is there are many times when you can enroll an Advantage plan throughout the year, potentially. Okay, the advantages of Medicare Advantage, I might more aptly call this compelling statistics on Advantage plans. Over 24 million people had one in the United States, had an Advantage plan in 2020. Of those, 93% of them reported satisfaction with it. So a lot of people have them, a lot of people are satisfied. And likely part of the reason is because they tend to save at least 25% using an Advantage plan than if they just had Medicare alone. Okay, now to compare them side by side, here's original Medicare, here's Advantage plan. Coverage for hospital stays, it's basically Part A. Coverage for some medical care like doctor visits and flu shots, that's basically Part B. Well, they both have that, original Medicare and Advantage plans. What original Medicare doesn't have, but what Advantage plans do have, prescription drug coverage. Some potentially have routine vision coverage, like a zero copay eye exam, or maybe some credit for eyewear. Routine hearing exam, similarly, maybe some credit for hearing aids and or dental. So some of these are available, and then limiting your out-of-pocket costs. So regular Medicare doesn't have any of that. Now these vary plan by plan, but an Advantage plan has that. So my message is Medicare has Part A and Part B. Well, Advantage plan has that and then some, including drug plan and other benefits that vary plan by plan. I'm going to run through a top 10, not necessarily in order, but these are just compelling things to be aware of that I feel I would be remiss if I didn't remark. Number one, you must continue to pay your Part B premium. So even if you sign up for a $0 Advantage plan, that's great value, right? You're going to get some benefits from it, but you do have to keep paying Part B premium, which I remarked for 2020 was around $145 a month for most people. Medicare Advantage plan has you covered. It does have the Medicare stuff in it. That's a side-by-side comparison, and then some. Joining a Medicare plan may affect your current coverage, either because you're working and then you retire and lose coverage there, or maybe because you're a veteran. There's special reasons why you need to be aware of what you have before and then after when you sign up for an Advantage plan. It's best to use network providers. We almost never say the word best in the Medicare world because depending on what happens, you don't necessarily know, but that is the case because it'll always cost less. So it's best to use network providers. Some plans allow you to go out of network either for care or maybe for pharmacy, for drug prescriptions, but it's best that it's going to cost less if you use network providers. You may qualify for financial assistance. I mentioned financial assistance in the form of extra help from the federal government. Also, state programs like Medicaid are administered through the state. You might qualify for those as well, and they have implications to which plan you might sign up for. If you enroll in Part D late, you may pay a penalty. I mentioned that once, but I'll just say it again. Even if you don't have drug coverage, I'm a proponent of signing up for some kind of coverage just to avoid the penalty, because if you wait, that penalty can accumulate. The longer you wait, the more expensive it's going to be. A Medicare supplement insurance plan, sometimes called a Medigap policy, is not a Medicare Advantage plan. That was that option 1, option 2 I showed earlier. There's simply two different things. One costs significantly more per month, but has very little out-of-pocket cost potentially. The other one can cost very little out of monthly, but will have more cost as you seek care. Keep your member ID card handy. If you sign up for an Advantage plan, you can leave your Medicare, which is government issued card, at home, and you can carry that Advantage plan card around. When you go to the doctor, you present that card. If you go to the pharmacist, you present that card. Maybe if your plan has dental, hearing, vision, you go and present that everywhere. So it's a single card you carry around everywhere. Advantage plans offers the same protection as original Medicare. To reiterate that, it's got everything Medicare has plus, and then you have a built-in financial safety net. What I would remark, once again, is there's no out-of-pocket maximum. So as your care goes on through the course of the year, you're paying. If you're on regular Medicare, if you have an Advantage plan, at least there's an out-of-pocket max set, and it varies plan by plan. Maybe it's $3,500, maybe it's $4,000, $5,000, whatever it is, but at least there is an out-of-pocket max set. Once you reach that, you will pay no more out of your pocket. The plan will pay the rest of your care for that year. Okay, drug coverage. I got several slides on this because it is a point of confusion. I want to talk through this. This first slide does a nice job of explaining a classic question that I have from people. They want to know, hey, I've got one medication or set of medications that doesn't change across the year. I go to one pharmacy. Why does it cost me different amounts during different times of the year? This chart nicely explains that. Number one, there is an annual deductible, perhaps. Some plans don't have a deductible, but if you do, then you got to pay 100% of the cost of the medication until you've met that deductible. So I just make up a scenario. If your plan has a $300 deductible and your single drug or your groups of drugs cost $100 a month retail, then for the first 3 months, you're going to pay the 100, 100, 100 each of those months because you have to meet the deductible. If your plan has no deductible or after you met it, then there's 3 other phases here: initial coverage, the coverage gap, and catastrophic phase. And so what happens is once you're in those, then you pay a subset of it depending on what your medication or list of medications is. And I'll talk more about that. You pay a subset. So I'm going to make up an example again. Maybe it's one expensive drug or group of drugs, but I'm going to say the bill monthly. Let's say your plan has no deductible, but the bill is $1,000 retail, but your copays come out, just to make the math easy, $100 a month in the initial coverage phase once it's in there. So for several months here, you're going to go on and your plan pays $900 and you pay $100. Month 1, month 2, month 3. Once the total drug cost exceeds $4,100, in other words, say month 5 or so, once you've exceeded that, then you're going to go into what they call the coverage gap. Once you do that, instead of just paying that $100 copay, you're now going to pay 25% of the cost of the drugs. So where you were, in my example, if you're paying $100 on a $1,000 bill of monthly, now you're going to pay 25% of it, or $250. And so for the next few months, you're going to pay that $250 until your total cost, in other words, month 7, for example, or so, exceeds $65.50. Once it does, then you drop out and you're in the catastrophic phase. So for these few months, you're paying $100 in my example. The next couple months, you pay $250. And then once your total cost has exceeded that, then you're going to either pay these low copays or 5%, whichever is greater. I'm going to go ahead and assume it's greater. And for ease of discussion, that's $50. And so the rest of the year, you'll pay that. So my message is, you're going to pay different amounts depending on which one of these phases are in. If you have a drug deductible in the coverage phase, you pay the copay until you're in the coverage gap, and that's dictated by the total cost of your medications. And then when you get on the backside of it, once it gets too much, you're in catastrophic, and you end up paying 5%, for example. Okay, got a few more slides on this. Total drug cost. To reiterate, there's what you pay and what the plan pays. The total drug cost is the combination or the total of that, and that's what determines which phase you're in. It doesn't include your drug premium, by the way. And then out-of-pocket costs, on the contrary, that's what you're paying. So in my previous example, you were paying $100 for a few months. You pay $250 when you're in the catastrophic, and down to $50. Whatever you pay, and if there was a deductible you paid there, that's your out-of-pocket. And that doesn't include your premium. So those are just 2 things to understand, the distinction between those, and understand that this is the one that's used to determine where you are, which stage you're in. Okay. Pharmacy network. United Healthcare has over 65,000 pharmacies in the U.S. The implication is there's likely one near you. Can't guarantee that your favorite pharmacy is in the network, but it's likely that it is. And if not, it's very likely there's one near you that is in network. You can save on prescription from in-network retailers. Kind of said that once already. You can also save on mail order pharmacy. So there's 2 different ways that you can save. 1, go to in-network, and then 2, go to use mail order. Not always will one save versus the other, but it's good to take a look at both of those. The drug list is called a formulary. Not every single drug in the world is covered by a plan, but everyone that they covered, and there are a lot of them, is in there, and they're classified by tiers. Tier 1 is a preferred generic drug. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs, and Tier 5 is specialty drugs. And I suspect you might be able to guess the cost and or the copay goes up as the tier number goes up. But every drug that they cover is in one of those tiers, and that's how you can determine how much your medications will cost on a given formulary, that is drug list for a plan. A few more things here. Step therapy is when you try to use a lower cost medication to treat a condition and then go up to the higher one if the lower cost one isn't effective. Quantity limits, as the name implies, is there may be only a certain amount of drug per copay or a certain number of days. There are limits placed there to make sure it's a safe and effective use. And then prior authorization is when the doctor gives authorization to get a drug, for example, or switch drugs. So those three vocabulary words are required kind of for this final slide here. You can get an exception. You can get an exception if it's not on if there's not a drug plan on there, you can request an exception. Or if there's a restriction, you can request an exception. And having said that, if the doctor submitted the exception request on your behalf, the decision will be made within 72 hours. You can't request an expedited or fast track decision if your doctor says your health depends upon that. Okay, so now what I'm going to do, we've talked about Medicare, we've talked about drug plan, and I'm going to show you some specific for a Medicare Advantage plan side by side and show you how they're similar and yet different. These happen to be for the Dallas-Fort Worth area, but I assure you in other parts of the state of Texas and in other states, there are some similar plans to these. The numbers, the dollar amounts may vary some, and not every single plan is available in every place, but these are some nice examples. So I would encourage you to take a look through this. I got like 4 or 5 slides comparing these 4 plans side by side to see which one of these features of the plans are important to you to help you select which one you would like, or a comparable plan, I should say. Okay, so this is Plan 1 and Plan 2. They've been around for many years here in the DFW area, and here's some newer plans. This one's called Advantage Plan, and this one's called Choice. This Advantage Plan is actually kind of a reboot of Plan 1. They're quite similar. I will point out some differences, certain features that I think United Healthcare determined the market wanted versus others, and so they've made 2 similar plans with just different features. So these 3 are HMOs. The implication is you need to go in-network only. If you go out of network from an HMO, the plan doesn't apply. You'd have to pay for all that care out of pocket. So you want to go in-network on HMO plans. This PPO has out-of-network options. Now, it'll typically perhaps cost more, have a higher copay, for example, but you do have the option to go out of network. So what we're going to find, we're going to compare all these. What we'll find is, as a general rule, there will be higher copays and lower costs for this one. I'm sorry, higher copays and higher cost for this actually, and lower benefits. And then conversely, for these 3 HMOs, what will happen is Plan 2 is actually kind of a paid version of Plan 1. The other 3 have a $0 monthly premium. This one, where you go ahead and pay a little bit each month, you will have lower copays and higher benefits. So that's the way this is going to work. So monthly premium is 0 for 3 of them. Even the PPO, it's $0 monthly premium. But this one, you pay $73 a month. And what we're going to see as you go further down here, certain benefits you get, lower copays and higher benefits on that paid plan. Annual medical deductible is $0 on all 4 of the plans. Primary care visit is $0 copay for all 4 of those plans. So the first 2 lines besides the premium, they look the same. Specialist visit, although it's not a big difference, Plan 2, where you're paying the monthly premium, it has the lowest specialist visit copay of $20. And then this plan, the PPO, where you have the flexibility to go out of network, it costs $35. It has the highest copay. Specialist referral required? Yes, yes, yes for the 3 HMOs. Actually, no for the PPO. So the PPO not only gives you the flexibility to go out of network, you don't have to get a referral from your primary care to go to a specialist. So there's some flexibility, some niceties associated with this plan, and it does cost $0, but you'll see later on it costs you more over as more care is required to have that flexibility. Okay, preventative services are also $0 copay on all 4 of those plans. Here's the first significant number difference if you go hospital stay. If you go to hospital stay, for Plan 2, it's just a $150 copay. So that's the lowest cost of a hospital stay. For Plan 1, it's actually a $275 copay for the first 5 days. Then it drops to $0 copay after that. So comparing the 2, yeah, that one costs you more. Actually, these 2 newer plans, they have some other benefits, but you do kind of lose it here. That is, they cost a little bit more. They cost $325 the first few days, and it's actually 1 day more. You actually go to day 6 before it drops to a $0 copay. So right away, there's some significant differences here you can see between these plans if you go to hospital during the year. Skilled nursing facility. Similarly, actually on these, the first 20 days on all 4 of these plans, it's $0 copay if you go to skilled nursing facility. If you have to stay longer, then what you're going to find is the copay value is the same. It's $184, but the number of days that what you would have to pay, if God forbid you had to stay a long time, is different. So the plan where you have a paid premium acts as the lowest number. You only have to pay through day 38. After that, then it goes back to $0 copay. On Plan 1, it actually goes to day 42. So it's a few days more. Same thing with Advantage Plan. If you recall, I said they're kind of similar. So these 2 HMO plans, you go a few more days at $184. On the plan where you have the most flexibility, you actually have to go all the way to day 57 of paying that $184 copay. So again, the flexibility of this plan costs you a little bit more if you have to spend time in skilled nursing facility. Outpatient surgery, these numbers reflect the same thing as the numbers in the hospital stay. That is a max. It can be a $0 depending on what it is. The maximum copay for the plan where you have a paid premium is only $150 if you have outpatient surgery. On this Plan 1, it's $275, which is the same number as the daily rate in hospital. And then for these 2 plans right here, it's actually the same as their daily rate, which is a $325 copay. That's the max for an outpatient surgery. Diabetes monitoring supplies and home health care have $0 copays on all 4 of these plans. So I've got a few more slides just like this so you can kind of see the difference, but I think you're getting a feel for what's going on here. Flexibility, costs more, you can pay the plan and actually drive down your costs and or get more benefits. You'll see that too. Okay, diagnostic services. The older plans, actually the max is $125. Actually for the newer plans, it's $25 more, $150 copay. Diagnostic tests, the older plans are $20 copay. And the newer plans are $25, a little bit more, but not that big a deal. Lab services are $0 copay on all 4 of these plans. And then outpatient x-rays actually are $0 on all the plans with the exception of the PPO. On the PPO, it is there's a $15 copay. Ambulance is the same for all 4 of these plans. Ground or air, it's a $250 copay. Emergency care, similarly, it's a $90 copay. And then if you get admitted to the hospital, then it goes again into the hospital stay and that gets waived. But if you just go to the emergency, then it's $90 copay. Urgent care, for the 3 HMOs, it's a $40 copay, whether it's contracted or not. Actually, for the PPO, it actually does go down a little bit. It's a $30 copay if it's a contracted facility. Now, here's the biggest financial difference between all 4 of these plans, the total out-of-pocket maximum that you will pay for care that year. For the plan where you're paying a premium, it's $3,200. That's the out-of-pocket max. For Plan 1 and the Plan 1 reboot, if you will, it's $3,900. And then for the PPO, it's $6,700. So the recurring theme, pay the premium, you have the lowest copays and the highest benefits, you will, or on the contrary, for the flexibility, you have a highest out-of-pocket max, for example, in copays. Okay, a few more slides that illustrate this further. Not going to go through all the drugs, but what I would offer, kind of keeping on the theme, for Tier 1, for the plan where you pay, there's a $0 copay. For Plan 1, there's actually a $2 copay, and then for the PPO, there's a $3 copay. So it's only a $1 difference, but it's like that. If you look at the annual deductible down below, actually these 3 HMOs have a $0 deductible on all tiers. For that PPO, the $0 deductible is only for Tier 1 and Tier 2, the lowest cost drugs. For drugs that are Tier 3 and higher, there's actually a $345 deductible that you got to meet annually before the plan kicks in. Okay. Now, these are some extra benefits above and beyond Medicare discussion. So there's some dental, vision, hearing, that kind of stuff. Let's look at that. On dental, the plan where you pay premium and actually the reboot, they give you more dental. That is, there's up to $1,000 of covered dental services per calendar year. On Plan 1 and the PPO, it's $500. Still good coverage, but you just get more for the one where you're paying and or for the new plan. Routine vision care, all 4 of these plans have a $0 copay for 1 routine eye exam every 2 years. Then they give you a $100 allowance for eyewear, except for the one where you're paying premium. Actually, it's $200. So that's the example of you get a little bit more for your money, or when you're paying the premium. The other 3 plans, we'll call, are $0 premium. Routine hearing, actually, the older plans have routine hearing coverage. That is a $0 copay for an exam, and then some copays. They've got a spectrum of hearing devices you can get, but some of them are as low as $175. So that's 2 devices every 2 years. Actually, don't have coverage in the newer plans. So you get more, the older one and new one, kind of depending on where you are in hearing, perhaps. Insulin senior savings is the same. It's a maximum of $35 for a month's supply of insulin on 4 of those plans. There's an over-the-counter credit, interestingly, perhaps counterintuitively, on every one of these plans except for Plan 2, the one where you're paying the premium. And on this, it says $160 a year. It's really $40 a quarter. Every quarter, you're given a credit, and you can, by a phone or on the internet, order parts. You can order over-the-counter medication. So this isn't prescription drug. This is stuff, aspirin, antidigestive, even Band-Aids, personal care, stuff like that. Things you might get over the counter at a pharmacy, you can order those, and there's a $40 credit each quarter. So that's a nice benefit. And then finally, a gym membership. Actually, all 4 of these plans have membership in Renew Active. And Renew Active, among other things, it's a health and wellness program, but if nothing else, what it does provide is a free membership. Now, kind of like the pharmacy illustration, there are a lot of gyms that take it. Not every single one in the world, but either the gym near you will take it, or there'll be one near you that does. If your favorite gym doesn't take it, one near you will take it. So that's nice. Basically, a gym membership at no cost. Okay. Now, I'm not going to spend a lot of time on this slide. This basically is just the exact names of the plans, their plan numbers, and the counties they're offered in. If you live in the DFW area, these exact plans are available to you. If you live somewhere in Texas, there's some similar plans to you. In fact, if you live anywhere in the United States, there's a plan similar to one or more of these plans. This illustration was just nice to lay them side by side to show you how they differ, so you can think about which one of those features, and I'm sure there's multiple ones, are important to you. Having said that, a little bit about United Healthcare. They've got over 40 years serving the Medicare community. There may be other carriers that provide Medicare plans, but these guys have been doing it for over 40 years. More people in the U.S. choose United Healthcare than any other. Members do like and keep their Advantage plans. They don't get a lot of complaints. And then finally, you have our promised commitment to helping you live a healthier life. Will be it that free gym membership, or personally, I work in retail establishments, sometimes representing United Healthcare, answering questions. They really are committed to helping folks live a healthy, happy Medicare journey, 65 and above. So having said that, there's a few more resources I'd want to make you aware of. Medicare Made Clear is a hard copy booklet, not unlike this presentation, that you can get from United Healthcare. Medicare Helpline, you can actually go to medicare.gov and or call CMS, which is the government organization that administers Medicare, and you can get help there on enrolling in Medicare for the first time, that kind of thing. Medicare and You is a nice, generous, thick, hard copy book that the CMS, the same organization that does Medicare, sends out to most people when they're approaching 65. Online plan finders, those plans that I showed, you can go online and find those different ways to do that. State resources, you can find out about eligibility and even enroll or apply for Medicaid, for example, the financial assistance administered by the state. Social Security at ssa.gov, not unlike Medicare, you can call and talk to them. You can go online and find out about doing that. If you want to have your $145 Part B premium deducted from your Social Security benefit, you can arrange that and get that set up too. And then finally, administration and elder care locator online, you can find, for example, home health care in network near you. So there's a lot of resources available online, via phone, and in print. Having said that, I can help you find those too. I can look up your doctors and make sure that they take a plan you're considering. I can take your list of medications and I can show you how much they'll cost across different plans using that tiering system, and really even across retailers near you. I can help you check to see which gym near you gives you the free gym membership. I can provide some guidance for you, help you find, for example, where to apply online for Medicaid for additional financial benefits. And then if you're a veteran, even though you've got the VA, TRICARE, something like that, some of these things like a dental, vision, the gym membership, maybe you don't want to go, maybe the VA or where you would go to get some of this stuff is far away from you. We can help you find plans that are designed to work with VA benefits, for example, that don't have pharmacy coverage. They don't have the drug plan coverage. You continue to get that from the VA or TRICARE, and yet you can take advantage of some of these other plans, buy some Advantage plans specific for veterans. Having said that, to reiterate, my name is Tom Basie. I'm grateful for your time today. It's nice to have spoken to you. I do have my phone number and email there. Please do consider reaching out to me if I can be of any service. Yo hablo español, así que yo puedo entender a la gente en su idioma, se sienten más a gusto hablando español. Thanks very much for your time. Have a good rest of your day. That's all.